So this case is a little bit more involved than my standard case. I'm Dr. David Gay. I'm an oculofacial plastic surgeon. So a couple things here on this guy. So initially, let's go from top down. So if we look at his upper eyelids, he has that hooded skin coming down and blocking his vision. So an upper blepharoplasty, removing that excess skin, allowing us to see the eyelid again, and then unhood the eyes. So you can see how much brighter his eyes are. So that blue just really shines forward now. Lower eyelids a little bit more involved than a traditional blepharoplasty. So traditional blepharoplasty involves removing the fat, maybe taking a little bit of skin or a little bit of laser. Now for him, yes, he has the lower eyelid bags, but he also has this area here that's a festoon. The festoon is fluid. When it comes all the way over to here, it can be a malar mound, but it's fluid that's trapped underneath the skin. There are a lot of different treatment options if we're trying to avoid surgery. They all have pluses and minuses, but they fail more often than not. So the most definitive way to address this is to do a blepharoplasty, but after I remove the fat, I make an incision here where I usually do to remove a little bit of skin, but then I go underneath the skin all the way down below where the fluid is, and I release the ligament there, basically getting rid of the pocket where the fluid builds up. And then I redrape the skin and pull it up and anchor it to the bone here. So there's a lot of deep work. There's a lot more work that you don't see. The good news is you don't see it. So his scars are minimal. He looks great. You know, as a perfectionist, sure, I'd love to do a little laser here, get rid of some of those wrinkles on the lower eyelid and out to the crow's feet. But, you know, we don't always have to go for perfect. He wants to look natural and younger. And I think we achieved that. He looks great. Nobody's looking at him thinking he had surgery. They're just looking at those beautiful blue eyes, and he's very happy with the results, as am I. So there's not a one-size-fits-all for anybody in surgery. It needs to be tailored to your specific needs. So if you want to discuss different needs, or if you think you might need the surgery, just reach out. I'd love to talk to you.